She signs the paper with shaking hands because the anesthesia nurse is already at the door, and the surgeon said, "We need to do this now." She nods because everyone in the room seems busy and certain, and she doesn't want to cause trouble. Later, she remembers a line from the form she didn't understand and sleeps with a small, heavy worry in her chest for weeks. That worry is what brings us here today.
Hi, I'm Jessica Tonia. Welcome to FAQ by Nurse Jessie, where healthcare facts beat internet myths. Let's separate medical fact from fiction, and today we're talking about informed consent, what it actually requires, who can sign, practical scripts you can use, and a checklist you can download in the episode notes. Full transcript, large print and translated checklist, and time-stamped show notes are available. I promise accessibility for all listeners.
Quick disclaimer before we dig in. Everything I share is educational. It isn't legal advice, and if something feels urgent or dangerous, get immediate medical care rather than waiting to run through every detail of this episode. Now, what does informed consent actually mean?
At its simplest, informed consent is a conversation with a purpose. You should be told the benefits of a procedure, the risks, realistic alternatives, including doing nothing, and that your decision must be voluntary. Those 4 pieces are the backbone: benefits, risks, alternatives, and voluntariness. Also, it's a two-way street. Clinicians have a responsibility to explain things clearly, and you have the right to ask questions and to take time to decide.
Let's unpack each element briefly. Benefits: what the procedure is expected to do for your health. Risks: not just the big scary words, but the realistic chance of things going wrong and how serious those outcomes would be. Alternatives: maybe there's a less invasive test, or a waiting and watching approach, or a different medication. Voluntariness: you must not be coerced. If you feel hurried or pressured, that's a red flag.
Who can legally consent? Quick guide. Competent adults generally consent for themselves. Parents usually consent for their minor children, though the rules vary depending on the age and situation. A legally appointed surrogate or power of attorney can consent if a patient lacks capacity. In emergencies where waiting would cause harm, clinicians may act to save life or limb without assigned consent. That's an important exception. If you're unsure whether someone can speak for a patient, ask to see documentation, a power of attorney form or a guardianship order, or ask the patient's nurse or patient relations for help.
A few confusing phrases you might see on paperwork or hear in the room. Routine risk doesn't mean no risk. It often means risks that are commonly expected. Rare complication means the chance is low, but the outcome could still be serious. Standard of care is not a guarantee of success. It means the widely accepted way to treat a condition. If any phrase feels vague, ask, "Can you explain that in plain words? How likely is it? What would that look like for me?"
Now I'm going to demonstrate a short role play, 2 minutes, so you can hear scripts that work in real conversations. I'll do both parts, clinician and patient. Listen for 1-line and 2-line scripts you can use or adapt.
Clinician voice, calm and steady. We recommend removing the cyst today. The benefit is lowering infection risk. The main risks are bleeding and infection, which happen in about 1 in 100 cases, and a small risk of nerve irritation. An alternative is watchful waiting with repeat imaging in 3 months. Do you have any questions about that?
I have one quick question. What would it mean if I chose to wait? Would the cyst likely get worse? Also, I need a few minutes to think and to call my sister. Can we pause for that?
Absolutely. You can take time. If you want, we can set a time to talk in an hour after you've called your sister, or I can answer any specific questions now. You're entitled to a decision you make without pressure. Quick follow-up tips from that role play: use short scripts, 1-line scripts like, "I need a few minutes to think," and 2-line scripts that add a reason, like, "I need to call my family before I decide." Those are simple, polite, and they work. If someone pushes back, repeat the request firmly and name the boundary. "I understand the concern, but I need 15 minutes. Practice these lines aloud at home. They feel easier when you've used them once or twice.
Types of consent to recognize.
Procedural consent covers surgeries and invasive procedures. Anesthesia consent specifically covers anesthesia risks. Imaging consent may include contrast dye risks. Verbal consent is acceptable for many routine things, but should be documented in the chart. Written consent is required for most invasive procedures. Best documentation practices: get names, dates, and signatures, and make sure the chart notes reflect the conversation, not just that a form was signed.
Where to find jurisdictional and institutional signposts? I put links in the show notes to state law summaries and to the patient advocate or patient relations contact for many major hospitals. If you need local law, search your state government site for informed consent, or call your hospital's patient relations and ask, "Where can I find your consent policies?" Keep those contacts in your phone before you need them.
When should you pause, ask for time, or seek a second opinion? Anytime you feel rushed, confused, or uncertain about the likely outcomes. Say, "I need time to decide," or "Can I discuss this with my primary doctor?" If you anticipate conflict, bring an advocate, a family member, friend, or a patient advocate from the hospital to support you. You won't be labeled difficult for asking questions. Good clinicians expect them.
Practical documentation habits. Timestamp conversations in your notes or on your phone. Photograph forms if allowed. Ask to have the consent form printed in large type or translated if needed, and request that documentation of the consent conversation go into the medical record. Copy yourself or your advocate on any email summaries, and keep a single place, a folder or phone album with photos of forms and notes.
Accessibility and resources. Remember the checklist in the episode notes. Large print and translated versions are available. The notes also include timestamp links for each section we've covered today and contacts for finding patient advocate services at many hospitals. For complex legal questions, consult local patient relations or an attorney. Links are in the show notes. 3 concrete takeaways to keep with you. 1. Before you sign, make sure someone explains benefits, realistic risks, and alternatives in words you understand. 2. It's okay and often helpful to ask for time or to involve an advocate. 3. Document the conversation. Date, time, names, and a short note of what was discussed. Keep a photo of any signed forms. Those 3 actions protect your ability to make informed decisions. Quick reassurance. In true emergencies, clinicians will act to protect your life, and that's appropriate. The guidance I've given is for situations where there is time to discuss choices. If in doubt about immediate danger, call for immediate help. If you found this episode helpful, please download the one-page checklist in the show notes and share one takeaway with an advocate, family member, or on social media. Subscribing is the best way to make sure you don't miss future episodes, where we'll break down more patient-facing topics. Until next time, stay informed, stay compassionate, and always put safety first.